We want about 10 minutes about COVID?
Yep.
Okay. Well, I'll introduce myself briefly. I'm Kelly White. I'm a pediatrician who has worked in Germantown for decades, and I'm the medical director for Frankie's World Medical Daycare and Mars Care, a home health care agency. These have been trying times for all of us, and we're now more than a year into our COVID experience. And I'm going to share with you a few thoughts with also sharing some documents from the Philadelphia Department of Public Health. It's hard to stay on top of this information. It's all coming out every day. There are constant changes, some of which relate to our vaccine status, but some of which relate to the situation with coronavirus around the world. So I'm going to go ahead and bring up the Philadelphia Department of Public Health's website, which of course is not right now showing up on my options. So I apologize. I'm going to scoot away from our presentation for a moment and try to bring that back up. Excuse me for the delay. Let's try that again. It should have been there. Okay, so here we are again. The city is still doing a lot of testing, and I'm grateful for that. As you may know, some of the large testing sites that were associated with drugstores and other facilities have shut down, but we are still doing a lot of testing. And so this top graph in blue demonstrates tests being done. And here we were in the mid-spring of last year, and we were not doing much testing. There weren't a lot of tests available at that time. So you can see we ramped up steadily, and by the holiday season, we were doing many tests each week. So you may even be able to read the fine print there, a 7-day average of almost 2,000 tests. Now, if I come out here, we are at even a little bit higher level. And I'm sorry, this can't quite be right, but I think this is actually the daily amount of 2,000. And here we are with about 7,000 over 7 days. Most of the tests are fortunately negative. And some of our tests now are done on people who are not symptomatic, but are receiving testing for a variety of purposes. Such as related to travel or related to having procedures done in hospital. So again, you can't totally compare the whole experience over a year and a quarter. Things were different at the beginning, and they continue to be different today. Now, this orange graph represents positive test results. And it's easy to see that compared to the blue, we had a higher percentage of positive test results at the beginning and I'll show you the percentage line in a moment. So we had the springtime peak, which at this point doesn't look anywhere near as impressive as the holiday season peak in caseload. And unfortunately, the holiday season was a particularly difficult time for many of us. And then we had a nice decrease in cases over the early spring, but as you could see, things began to climb again from March through April. And if I was talking to you a couple of weeks ago, I would have still been extremely concerned, because at that point, I had no way of knowing whether or not we were going to continue to climb. But I feel quite reassured that case numbers have dropped over the last 2 to 3 weeks. And the percentage of positive tests has also changed. So this purple line represents percentage of positive tests. And you may recall from earlier conversations that this concept of percentage of positive tests as a window into the disease prevalence into a community has been helpful in many regards in trying to make public health decisions. At various points, the number 2% was used as a suggested place to do some opening up of communities. There was talk 6 months ago of, say, the New York City public schools opening up if New York City got to a 2% prevalence. So obviously, we know that the number of tests being done last spring was low compared to the positive rates. But if we start perhaps last summer, looking to compare to the point when we were doing a lot of testing, last summer and early fall, we had that 2% low positivity. However, as we moved into the winter, we got up to 13%. And this was also paralleled by the situation in the state. So the state of Pennsylvania has had a high positivity rate throughout much of the last 9 months. Now, we did drop over the late winter and early spring. We got as low as 3.6%, which is sounding very good, and went up again towards the end of March to 9.2%. And look at this happy news. We're down again to 3.2%. So who knows, we might meet that sort of magical 2% number soon. And does that really equate to opening up? It may. I'm going to show you another bit of data in a moment, which hopefully we can get to quickly. And that is data on immunizations. So immunizations are going to make an incredible impact on this illness. And we've all been very excited with this process. Although when I talk to any audience, I can't be sure that everyone is equally on board with the concept of getting a vaccine. I even spoke with a family of who were my patients this past week, where both parents had been extremely ill with COVID, and yet they were ill last winter, and they are hesitant to get vaccine. So that we have a lot of decision points here. So here is city data on vaccines being given. And we began giving vaccines in late December to healthcare workers, mainly at large hospitals who had the right deep freezers to store Pfizer vaccine. And you can see that we really did ramp up quickly. And now maybe we've plateaued in the number of vaccines being given each week. Obviously, we have to give a lot of credit to groups like the Black Doctors COVID Coalition, who did an amazing job providing vaccine in underserved neighborhoods. But there are still a few reflections to consider, even though they've done this fantastic job. The city did not really start to do sort of open walk-in immunizations in some of the communities in North Philadelphia and other parts of the city that were really extremely affected by COVID disease. And proximity and the ability to walk in for vaccines is something that, for example, may have supported higher vaccination rates in Asian Americans due to the convention center site being adjacent to Chinatown. So we live in a world where there's a lot of factors to take into account as we try to understand these decisions. So again, we can see that there's a nice increase in people who are fully vaccinated. So we have about 500,000 people who are now fully vaccinated, and about almost 800,000 people who are received at least one dose. And so that begins to be close to half of the current population of the city that's 16 and up or 18 and up, and thus able to get the vaccine. Now, when we look at demographics, this is sobering. I didn't show the demographic section of the caseload, but obviously the absolute highest risk group for infection and death have been African Americans over 75, to some degree, specifically African American men over 75. So a nice element of these graphs is that if we take a look here, I think it's a nice element, in people over 75, we have a 65% vaccination rate for Asian Americans. We have, interestingly enough, a 62% vaccination rate for Hispanic Americans over 65. And we have basically African American and white Americans close to tied for vaccination rate among people over 75. So the blue line is African Americans, orange is white, light blue is Hispanic, and gray is Asian. Now, I would say that the city opened a couple of sites in Hispanic areas within the past few weeks, and that may account for this nice rise in Hispanic Americans at that time. And the Hispanic population had lagged far behind the Asian population up until that point recently. So that's the oldest citizens or people in our community. If we go down to the 65 to 74 rate, we find even a higher vaccination rate among Asian Americans. And we actually have just a little bit higher rate among African Americans than among white Americans. Interesting. And Hispanic Americans are kind of tied with African Americans there. So this may mean that it's a little easier to get around and get your vaccine if you're younger than 75. But I think this is kind of exciting that we see the African American and Hispanic ethnic groups catching up somewhat to white Americans. Going back to 45 to 64, again, Asian Americans have the beginning of the wave. But we are seeing clustering again, African American and white Americans we're getting close to the 50% range. The more concerning demographic might be the younger people. And here we find a really low rate of vaccination among African Americans between 20 and 44. We have Hispanics, Hispanic Americans a little bit higher at 31%. We have 45% of the age group from 2024 for whites, and again, the highest number among Asian Americans. Now, we fairly recently opened the vaccine up to anyone in all ages, and up until this time, many of the people in the 20 to 44 age group or the 45 to 64 age group were not eligible for vaccine. So this is all, a nice process of development. It may be necessary to be a little concerned about these numbers in white Americans seeming to drop off. And probably many of us have been following the news that talks about a great reluctance in one political segment of white Americans to receive vaccine. And that is something that concerns me a lot for the possibility of really reaching a place of safety for our entire country and all our communities. Now, this little graph is showing vaccination rates by zip code. And my own zip code, which is 19144, Germantown, is at a moderate pace. And this is number per 100,000. So we're creeping up slowly, but you can see that there are big disparities between zip codes. And so, can we get more vaccine opportunities into these light colored zip codes? Probably that can happen. It's very hard for some working people to receive vaccine. So I'm going to stop sharing this screen. And I wish I could be with all of you to try to answer questions. I'm sure you all have lots of questions. Among questions are, I got the vaccine, now what can I do? And the CDC does have changing guidelines, but I find myself having to remind people that having vaccine still is not a free pass to going back to life as we knew it. Among sort of the basic things that the CDC has said is that now you can get together with your unvaccinated children and grandchildren, which is pretty wonderful. You can get together in extremely small groups with other vaccinated individuals, meaning the setting of dinner for 4. If you go up to dinner for 8, you've got to share 2 tables. And this would include being outside in a restaurant. So we live in interesting times, and I know that your own community and your own group have done a great deal to support these public health measures. And I hope none of you have suffered personal or family difficult outcomes related to this virus. Thanks for listening.